Namaste everyone. Greetings from India. I am Dr. Vikram PATIL, Deputy Dean for Research, and I take care of clinical research at JSS Academy of Higher Education and Research, Mysore. I'm also a professor of radiology at JSS Medical College, and I head the Center for Digital Health and AI at JSS EHI. Today, I'll be addressing on the issue of current status and potential of medical AI in India. So the agenda that I have taken up for today's presentation is I'll be going through about a couple of slides about my organization. I represent JSS, about the health ecosystem in India, the rise of medical AI in India, applications and advantages of medical AI in India, the government initiatives in India, the contribution of academic institutes in the growth of medical AI in India, how startups are leveraging the AI ecosystem, the challenges and pitfalls we are facing in India, and what is the way forward for medical AI in India. So first, let me introduce you to my city, the cultural city of India, Mysore, which has a beautiful palace, it has wonderful greenery around, and a very beautiful city that I request every one of you to come and visit and have the experience of the culture of India. I represent a group of institutions called JSS Mahavidyapita, which has more than 350 plus institutions with presence in schools, colleges, various academic institutions, right from engineering to healthcare, and also presence in Dubai, Mauritius, and USA. So in that particular 350 plus institution block, I represent especially JSS AHER, which constitutes of a medical college, a dental college, pharmacy colleges in Mysore, Ooty, and also schools in life sciences and health system management studies. So JSS has been ranked as one of the top institutions across India in various sectors by the National Institution Ranking Framework. This is one of the government recognized ranking agencies in which we see JSS stands one of the top in all the fields it is participating in. It also stands first in the Times Higher Education Rankings, Impact Rankings 2024 in SDG 3. This is a very high ranking across the world, and we are proud to be associated as the number one in SDG 3. When we come to India as general, India is a huge country with a lot of population, a dense country. So we can just see a small example over here. I have represented three examples. The first one is the state of Kerala, which is almost equivalent to the population of Saudi Arabia. The state of Karnataka, which I represent, has a population almost like the United Kingdom. And Uttar Pradesh, which is a bigger state, is almost equivalent to the population of Brazil and Ecuador put together. Also, the health sector infrastructure of India is pretty varied. We have something called the public health sector, a private health sector, and also other various forms. In the public health sector, we have a primary health center, which is in a rural setup. We have community health centers, district hospitals, specialist hospitals. Also, apart from that, we have health insurance scheme hospitals, especially like employment state insurance scheme or central government health schemes, and even railways and defense. This is all running in the public health sector. Similarly, we have something in the private health sector, which incorporates nursing homes, polyclinics, private hospitals, even ours, which I represent, is a tertiary care hospital, which is a private sector. Apart from that, we have another form of medicine, which is called an indigenous system of medicine, which we call as Ayush in India, which includes Ayurveda, Yoga, Unani, Siddha, Homeopathy. These are alternative therapies of medicine, which are also accepted in India. Apart from that, we have various voluntary health agencies as well. So this gives us an expanded variety of how Indian health infrastructure is complex and is mixed with various kind of healthcare being provided across the country. Also, before I jump into the topic, I want to highlight you how a small revolution was brought about in a couple of years. We see every place, whether it's a place with a small petty shop which accepts 1 rupee to a place which accepts lakh of rupees, using these UPI codes nowadays, So this you can see is a phenomenal change in the Indian transaction. The digital currency is being accepted across India. We are seeing now almost trillions of rupees being exchanged every year just through this digital transaction. And this was a major disruption in India, which happened just for a couple of years. And COVID was a pathbreaker for this. We saw COVID change the whole scenario of how the economy changed from regular currency to digital currency. And this can be an example of how AI can evolve in India. The disruption happens pretty fast because the digital acceptance is pretty fast. The smartphone adoption is pretty good in India. So let's jump up to the topic of what we need to discuss today, the rise of medical AI in India. We see India is one of the largest sectors, both in terms of employment and revenue generation opportunities. And India witnessed highest increase in the use of AI during pandemic and also propelled the AI-related investment in the Indian medical and healthcare startups. In fact, India saw 73% AI adoption among healthcare and pharma companies during this period, as I mentioned earlier also about how the digital payments were accepted. Similarly, AI got being accepted during the COVID period. And the integration of AI has emerged as a game changer by revolutionizing the way medical tourism operates. And the government is also being significant push, and larger industry players are also interested to work with academia jointly in research and development in the priority areas, including innovative technologies in healthcare. The landscape of medical AI in India, as you can see across this image, you are seeing there's a significant rise in the way India is investing, and also the globe is investing in India in the medical AI sector. We see a almost 40% compound annual growth rate in the medical AI market. And especially with generative AI coming into place, there has been a significant disruption in the Indian economy. And according to a recent study by Goldman Sachs, research generative AI is expected to drive almost 7 trillion increase in global GDP over a 10-year period. And as we speak about the economy being different, also we see that the Indian healthcare sector is also distributed across variedly. As you can see in this particular image, India is represented by more than 1.4 billion population, but we see the healthcare there is a significant disparity in the healthcare. You see the dark orange color, which represents Karnataka in this case, which I represent, has the highest doctor to population ratio, whereas we are seeing various other states like Bihar or Odisha, they have very low doctor to population ratio or hospital to population ratio. So these are the impact factors we see where medical AI can make a change to the health sector. So there's a huge population with growing burden of the chronic diseases, and also there's a shortage of qualified healthcare professionals, especially in rural areas, and there is rising healthcare costs. So all these we see as an impact which can be changed by medical AI. Also, when we look into the applications of medical AI in India, India is witnessing a significant surge in AI-driven healthcare applications from diagnosis to treatment and beyond. And this growth is driven by factors like increasing government support, rising adoption of healthcare technologies, especially the digital healthcare technologies, and a large population size. So the government has identified few areas accordingly which it wants to prioritize, and it includes diagnostics as number one, drug discovery, personalized medicine, and telemedicine. These are the four key areas government is focusing upon and working significantly. If we see the market, there has been a significant increase in the investments in the market in these 9 key areas, that is robot assisted surgery, administrative workflow assistants, virtual assistants, connected machines, clinical trials, digital clinical trials, diagnosis, fraud detection, dosage error reduction, and cyber security. These are the key areas which are being seen as the huge market potential across the next 10 years. And when we see which are the untapped potential of medical AI in India, we see that early disease prediction and prevention is definitely the key area that everybody should be focusing upon. surgical procedures, AI-assisted robots assistants are the in thing and should be focused upon development of new medical devices using AI. Mental health has become a major problem in India. Of late, across the globe, we have seen a lot of mental health issues rising up, and India also is no different for that. And we see a lot of mental health issues cropping up, and AI may help in sorting out these problems and also streamlining hospital operations and resource management. So, what are the advantages when we look into medical AI in India? We see there is an improved access. We can improve the access to quality healthcare, especially in the rural and remote areas, reduce the healthcare cost by automating the tasks and improving efficiency, and also support preventive healthcare by identifying individuals at risk of developing chronic diseases, and personalized medicine by tailoring treatments to individual patient needs and genetic makeup. And we see that India has a different genetic makeup, and this personalized medicine can add significant value because there is definitely a misuse, or what we can say, an unwanted use of certain kind of medicines which can be changed by personalizing our medicine, and also drive innovation, especially in the fields of drug discovery and development of new medical technologies. Also, government has doing its own way of integrating AI in healthcare. So what government has done is it has developed something called as a National Digital Health Infrastructure. In short form, they call it as ABDM, the Ayushman Bharat Digital Health Mission, in which it has taken certain steps which are worth appreciating. The first one it has done is the health locker, which is called as Digital National Health Database, backed with cloud-based storage system, which serves as a single source of health data for the entire nation. It also has created something called as personal health records, which allow data to be available for citizens and for medical research purposes. There is something called Digit Doctors. There is a digital directory of doctors along with their name, specialization, qualification, number of years, and various other details. Coverage and claims digital platform. There is a national health analytics platform, and also the most path-breaking feature I feel is the unique health ID for each citizen. So every citizen of India is going to have a ABHA number. This is all in the process. Part of it is achieved, part of it is still being achieved. India being, as we already discussed, a huge country, it is going to take certain time for it to completely be accepted, but still the pathway is right, is what I feel. So how Gen AI is being used in this adoption of the Ayushman Bharat Digital Mission that I just spoke? There are set 3 milestones, and the first milestone is involving and creating a verified Ayushman Bharat health account during patient registration. So every individual is going to have a unique number, a barcoded number. So that is what is the first milestone it has set itself for. The second milestone involves linking a patient's health records with its ABHA ID, which allows the patient to access their own health records across India. So they go to any place in India, they can access it just like how it has been done either in NHS or various other ecosystems, where a unique number can be utilized for linking their whole health record. The third milestone involves developing health information user service that can enable viewing of a patient's health history by healthcare professionals. So that these are 3 milestones that the government has set itself for, and it's using Gen AI for all these milestones. And when we look at how this ecosystem is being connected, as I told you earlier also, it's a large ecosystem, a varied ecosystem, a complex ecosystem. So we see the citizens are being connected to hospitals and clinics or labs and pharmacies, which are the providers. The allied private entities, that are the insurance or the health tech companies, are being connected. The healthcare professionals, that is the modern medicine doctors as just we are, or Ayush doctors or other practitioners, are being brought into the fold. Also, there is a third sector which involves development partners, associations, regulators, program managers, and even the government, which is the policymakers, are all sitting together and making sure this happens as a combined ecosystem. And this picture which you are seeing next to you is a ID card which is being given to every individual, which is a barcode ID card. You just scan it or you just type the number, and you can access your cards across India in whatever form of ecosystem you are in, whether it's private, government, or even a small nursing home or a diagnostic center. Everywhere is going to be connected through this ecosystem through this number. And also there are various applications which have already started cropping in through this ABDM. So there are some of the startups which have started using it. I'm just giving certain examples. There are many of them. This is an AIM Healthy app, which is a digital health app dedicated to promoting good health and well-being for individuals, and is used to understand or know the risk of diabetes, heart disease, or various other problems. And this is ABDM compliant and functions as a personal health record app. Similarly, this is a Symbo.ai app, which is a speech to text to create e-prescriptions in under 30 seconds, and it's again launched by ABDM. And this is given free to certain clinics or small hospitals. So it's being adopted by various startups in various platforms. This is just an example of how it's being adopted. Before we go on and understand what are the next problems or way forward, let's understand how academic and research institutions are also contributing to this way. And I'm just taking JSSHR as a use case, which I represent, and how we are adopting. Similarly, various other universities and various other organizations are adopting in their own way. So what we have done at JSS is we have started data structuring in our own way. We represent an 1800 bedded tertiary care hospital with an inflow of almost 1 lakh lab reports being generated every month. So that way we are having a huge amount of data. So we thought, let's organize our data. So we are working with various agencies. In this case, a company called Global Value Web. We have joined hands together and set up the ODC India chapter. That's the Observational Health Data Science and Informatics chapter, in which we are organizing our data. So we have now grown, and we have added a lot of other collaborators also, right from various smaller hospitals to larger industries. So a lot of academia and industry work has begun in this front. Also, we do a lot of industry collaborative projects, right from whether it should be with Google Health. We are working with Google Health on prescription digitization, or even on a project called Amy. So we are working with Google on certain projects. Similarly, various industries like L&T on a chest X-ray project, even with Scanray on a teleport project, also with Johnson & Johnson on a drug-related project on how to utilize data to make sure we have better drugs. And even we have had discussions with Yon Corden on certain projects. Similarly, a lot of student-led multidisciplinary research is happening. These are all student projects which are just happening as academic projects, like breast cancer detection project or an acne vulgaris project, a lot of skin projects, radiology projects, pathology projects, even clinical decision support system, especially for malignancies, is happening. So we are doing this as student projects so that the culture of AI runs into the student blood also. Also, we are supporting a lot of startups. So startups which can be varied from India or across the world, we have been supporting them. And we validate them, we help them clinically. Also, we guide them of what is the best way of taking it up. We have been supporting various Indian startups and also a group of startups like NASCOM or IKP. Also, a lot of PhDs are going on in AI and data science across the board, whether it's be life sciences, pharmacy, or medical college as well. Also, we are running programs in like MSc Health Technologies in data science. Also, we are offering elective curriculum for MBBS students in digital health technologies and AI. So this is also, JSS has been working with even Japan for that matter, with accessible code in the current scenario. We are in discussion to make sure we make something happen on various capacities. So this was all about how an academic institution is working towards leveraging the presence of AI in India. So there are various examples I wanted to give, but for the want of short of time, we are just limiting to what an academic institution can do and is doing at various capacities. Also, the other major path-breaking change in India is startups actually. Startups are leveraging the power of AI technology in India and using it to various capacities. So I'll just run up a few of examples to tell how AI is being utilized by various startups. So we get a hang of what startups can do in AI in India. So if you look into the public health sector, there is something called Chavi, which is the India's first onco-imaging image bank. This is established with using the cancer database to make sure we have more than 20,000 profiles of cancer patients involved. We have something called Trinetra, which is using Microsoft and Force Health startup. Together, they are joined hands with Niti Aayog to come up with solutions for eye problems. The government of Karnataka, where I represent again, has come up with healthcare pods, which is again developed by a firm called Vebra. So it's a detachable eye hospital which can be moved, especially in contagious conditions like COVID-19 or tuberculosis. Also, we have come up with something called Vadva in EAI, which is again partnered with Central Tuberculosis Division of India. Tuberculosis still being a major problem in India. This is trying to eliminate AI, TB by AI. Also, we have something called eParvai, which is a cataract detection and screening system, which has been again adopted by the government of Tamil Nadu, which is using it to combat cataract in its regular policy making. Also, there is something called Niramaya Health Analytics, which is an AI-based detection for breast cancer using non-contact, non-invasive, non-radiation. And this is also being widely accepted across the rural areas as a screening tool. So these are some of the examples of how startups are being accepted across India. And Queer AI has been a pathbreaker in the startup world. It started working as a small startup and now it has made a huge investment and is growing not only from chest X-ray, it has moved on to other areas and is one of the startups to actually look forward to. Next, we'll move on and understand a little bit of telemedicine, which is again a path-breaking thing happening in India, especially with government also initiating various steps. Like government of India took the first step in making certain guidelines for telemedicine in 2020, and later it expanded and it also made it wanted to make a telemedicine hub in India. So it has set up its own telemedicine portal called eSanjeevani, in which it has made a portal where you can log in as a doctor or as a patient and receive your teleconsultation and break the divide in India of the health ecosystem. With all comes certain challenges, and with all this, we see there are certain challenges which have to be addressed. The first and foremost, I feel, is data quality and availability. There's data privacy and security issues. Also, we see there is no standardization of data because India is having different ecosystems. It's still collecting data in various forms, but with this ABDM coming into picture and also standardization like ODC India chapter coming into picture, we see there is standardization slowly beginning. Also, we see there is infrastructure limitations. There is a clear-cut requirement of a regulatory framework regarding use of AI and the legality of AI. Also, we see there is a skill gap and training. That is the reason there should be a need for more such courses like how JSS has begun to offer, which is bridging the gap between health and the technology ecosystem. Also, we should see there is certain financial constraints which has to be taken care of. A vast care of awareness and adoption has to happen because people have to move from the conventional ecosystem to an AI-driven ecosystem. And also there are certain cultural and socio-economic factors which need to be addressed and which can be taken up only as the time progresses. And also there are certain threats which have been perceived in India. The first being the cyber security threats. We saw the AIMS Delhi and to an ICMR data breaches. These are some of the top Indian databases. And when they get breached, people panic. That's natural. But also, these can be addressed, and it's being addressed at the government level, at the individual hospital level. But these are some of the threats, especially cyber threats, data accuracy, data security, and also the bias in training data from Gen AI model, because only when we have a standardized data, we are looking at a standardized output coming out of it. The government has also looked into creating a data framework, especially with the Digital Personal Data Protection Act, which has come into act since 2023. And we are looking into how it is going to impact the Indian healthcare industry. Although the government has given provisions for utilizing healthcare data on a anonymized manner with a certain framework to be utilized for research, but still there is something which is unanswered and that is still debatable. Also, government has taken a step to make sure the HIS and the EMR standards are also on par. So India has NABH, which is a hospital accreditation board. In this, now it has taken up a first step. In just last month, it has released its draft standards for debate on a hospital information and EMR, which has to be accepted across India. Also, we see certain potential risks as we progress, especially which can be misinformation and accuracy, discrimination and toxicity, societal implications, accountability or governance related issues, misuse of Gen AI or AI in general, privacy related issues, safety and transparency. These are some of the issues that have been raised repeatedly, and these only time will tell how these can be addressed, because these are only progressive problems and we will only understand them as we start adopting them in our ecosystem. So when we look at the future of digital healthcare in India, what I personally feel is there are two things that we should be doing. One is collaborative work, and this collaborative work means the government, the healthcare providers, the AI developers, the academia like us, the industries, and the patient. They all work together, and investment in infrastructure development has to happen. And government has taken certain steps regarding this. So it recently had a concept called AI, Make AI in India and Make AI Work for India. In that, they actually called collaborative effort between academia, industry, and various other sectors. And they have kept a huge sum of money for each center of excellence. That is almost 300 crore rupees. That's a huge sum of money in Indian sectors. So that is kept for each center of excellence. And even JSS participated in it with the concept of AMR, antimicrobial resistance being a use case. So various other collaborators put together their efforts. And what we see according to the potential use cases in India as per this report generated very recently is medical image enhancements, patient care management, disease diagnosis, drug discovery and development, medical education, and personalized medicine. These are the key use cases that has been generated by a recent report which was published in March 2024. What is the other most useful use case I feel is home care and geriatric care. And India, as we see, is actually a huge potential area for home care and geriatric care. And we are interested to work towards home and geriatric care, and we have started adopting it in a small way. So the mobile application we have started developing, which is a comprehensive geriatric care and a home care for elderly patients. So like this, there is a lot of potential for home care as well. So when we look at the way forward seems to be boosting investments. So AI integration into healthcare requires investments, infrastructure, regulatory mechanisms, stakeholders, and business models. Next is promoting telemedicine. Incorporating AI and telemedicine platforms can extend quality healthcare access to rural and underserved areas. Investment in research and development. Government has been investing and even integrating public and private organizations to work together. But the most important is industry academia collaboration, which will make a huge difference to this. Ensuring data security and privacy. There has to be a policy very clear cut safeguarding patient data and ensuring also the robust data security is in place. There has to be a data standardization, encouraging EHRs and interoperability between different healthcare systems and providers across India and the world. So by doing all this, what we see is there will be a huge impact in the Indian healthcare ecosystem, and this can democratize healthcare for all, meaningful insights from a vast data pool, managing revenue cycle of clinics with ease, preventing the risk of molecule interaction and antibiotic resistance, which is a major problem as I have been stressing a couple of times, leveraging medical records to accurately predict risk patterns in patients, transforming the mobile camera into a diagnostic tool which is being utilized widely across India. Also, higher compliance for a complex long-term healthcare problems. So I'd like to conclude by saying that while AI has been a boon in healthcare, some of the apparent roadblocks to more widespread healthcare adoption still include blind spots in data access and collection, privacy issues, data misuse, and regulatory ambiguity. India has begun its journey in AI-based healthcare and is growing rapidly with support from government. The idealistic goals of universal healthcare delivery and affordability that can achieved by AI healthcare is now seems to possible with a collaborative approach. And as more and more innovations are coming up in the AI-based healthcare services, the adoption of AI in India may soon be a reliability. Thank you very much for your patient hearing, and I'll be available on these email IDs. You can approach me if you want to work anywhere with India or me personally. We'll be happy to work. Thank you again for this wonderful opportunity.